Hi, it's Jessica DaMassa with WTF Health, and I'm here at the Connected Health Conference. And joining me right now, I have David Engberg. He is the Chief Technology Officer for Livongo. Hello, nice to talk to you.
Good morning.
Good morning. All right, so I understand that you have a little bit of a different background coming into healthcare. You are from Evernote, right?
Yeah, I was the founding CTO at Evernote. I was there for 9 years. So my background is more large-scale consumer internet. We signed up over 100 million people for our program, had more than 1 million records coming in every day. So I'm more on the big data consumer side. That's
very cool. And so I want to jump in and talk about that because I really feel like we don't often get that perspective here in healthcare. And so right off the bat, working at a company like Livongo and trying to make inroads into health systems and work with different health systems and health plans and kind of aggregate their data and discern meaning from it. What are some of the things that you've noticed off the bat that healthcare could do a little bit better?
Right. I think in healthcare, the first thing you notice is that everything's super fragmented, and the standards where they exist are a starting point, but then everything is customer negotiations. So a lot of the methodologies you apply in the consumer world, where you just scrape all sorts of random data, you can't do it because of HIPAA. You can't get it because of all the partnerships. So it's a much more methodical slog. That's an opportunity for a company like Livongo, where you actually do the work, you establish the trust over time, you build the relationships with the partners, you do all the hard data processing work, and eventually you can start pulling out all sorts of great value. But it's a pretty big barrier to entry for the average tech startup that's getting involved.
Talk to me a little bit about the platform that you guys have built.
Yeah.
What have you got right now? What are you adding on? What are you going to build? What are you going to acquire? Talk to me a little bit about that.
Yeah. So our mission is to empower people with any chronic condition to live a healthier and better life. And in practice, up until this year, you'd basically say that was a diabetes offering. So we had a fully connected medical device to do blood glucose readings with a cell antenna that would upload data to our cloud service. And over time, we've accumulated tens of millions of blood glucose values as real-time interactions with our members. We've been expanding that to try to service the whole person by taking into account other conditions they might have. So we launched hypertension this year, including a connected blood pressure cuff. And we acquired a company called Retrofit that does pre-diabetes, helps with obesity, things like that. So we've been gradually trying to take into account more of the things that would make someone healthy through connected devices and interactive services.
All right, so what else is next? I mean, where are you guys headed? What's on the roadmap?
Yeah.
Don't think I'm going to let you off the hook on that.
Yeah, exactly. I guess you'd say that right now we have 3 chronic conditions, and there's lots of obvious candidates next. Some of them are more directly in the metabolic space. You could deal with CHF. You could deal with any sort of cardiopulmonary diseases. But obviously, there's other things that have more of an indirect interaction. A lot of the root causes of some conditions are behavioral. So behavioral health would be a logical follow-on. We don't have anything to announce right now. All of those would be things we would want to have as a unified offering eventually to take into account all of the things that could help someone get more healthy. Some of them we might build in-house, we might acquire, we might partner, but the whole solution is what we want to deliver over time.
Talk to me a little bit about the data that you guys are collecting and what your plans are for that.
Yeah. I think for a medical application, we have a fairly large amount of data. Like I said, we have tens of millions of blood glucose values. We have over 100,000 cellular connected devices out in the field that are uploading data every time you do a finger prick. So that all gets consolidated in our data warehouse with things like medical claims, pharmacy claims, lab values, and then we can do real-time crunching on that to deliver real-time interventions. So at the moment that you're checking your blood sugar, we can give you a recommendation not just based on what that one value is, but based on the history of what you've done, the history of your prescriptions, the history of how you've interacted with our product. That kind of real-time bidirectional data exchange is kind of our secret sauce. Like that we aren't just dealing with data that's weeks old, that's months old. We're dealing with real-time data and from a lot of different sources.
zoom out to the macro level for me. So what other things are you seeing, I guess, from that data? Are you starting to see any patterns in behavior, things that correlate with the way that people are, I guess, experiencing their health on the day-to-day? Talk to me a little bit about that.
Yeah, I think one of the dirty secrets is like every company here will have some data scientists and talk a pretty big game about what they're doing with it. But realistically, for the first year or two, you can get just as much value out of some pretty naive, like hand-rolled patterns and just doing some manual analytics against your data. Okay. What we finally started to transition over the last year or two is to do some deeper dives where we're pulling out information that you couldn't get by just having a smart person doing some queries against the database. We've got data scientists that are now doing real machine learning algorithms, and we're delivering messages where they're being updated on the fly by the machine learning training to try to optimize for the highest amount of outcomes. So we have messages that are delivered on the meter that we call nudges, and we've been able to tune those and tune those and tune those so that we can deliver a message to encourage you to do something that would have the highest value. Check first thing in the morning, because that would give you a good baseline. We found that not only does that increase your likelihood of checking in the morning if we time those right and deliver to the right people, it also improves your chances of checking through the rest of the day. It improves the overall picture that we get of people and gives you more information as a person with diabetes for how to help yourself manage your blood sugars more carefully. So that kind of a whole system, real-time feeding through machine learning algorithms is we're finally at the point where that's delivering more value than you'd get from just hard work and naive analytics.
So patient centricity is becoming, more and more of a thing here in healthcare, right? And even your CEO, Glenn Tolman, just recently, the book got published and released on our terms, which is about consumerism in healthcare. So I have, yeah, so do I. Mine's signed as yours. So weigh in for me, I guess, from your perspective, I guess, which is a combination, from your background, working for a consumer tech company, and then now here you are, and you've got the CEO of your company here in healthcare talking about consumerism. Is there a difference between a healthcare consumer and just a regular consumer of tech?
Yeah, I certainly would never disagree with my boss. He pays my checks, and obviously no one's going to disagree with giving consumers the ability to access more information, the ability to make more informed choices. Sure. But on the other hand, I think that you can over apply tech consumer metaphors to healthcare in a way that's actually an anti-pattern. I think that if you focus on engagement for its own sake, if you try to maximize the number of minutes that somebody is interacting with your platform, that's great if you're Facebook. For a health consumer, that's actually not what they want. People do not want to spend more time engaging with their medical condition. They just want the problems to go away. So I think that in the short term, they'll actually be. It'll get worse before it gets better. There'll just be more crap that you have to deal with if you've got a medical condition. Over the long term, I think companies will figure out how to give you the option to do things without necessarily forcing you to do more work. So one of the things that we did this last year, not a big deal, small little piece of an idea, was we realized that we had given people 20 different ways where they could say, I need more blood glucose strips, I need more supplies. You could do it on the meter, you could do it in the app, you could do it on the web. We gave you all sorts of ways to consumerize. But what we finally realized is people don't want more ways to do it. They just want to just get taken care of. So now we watch how many strips we've sent you. We use the real-time feedback to know how many you've consumed, and we send you strips before you need them. Nice. So that is consumerization actually successful, where you don't have to think about it. We want to take things off of your plate as opposed to adding more. And I think that's the challenge, is how not to just make things worse. Yeah.
Well, yeah, and it becomes intuitive then at that point as well. So it is really frictionless, which is, I think, what people are kind of clamoring for.
Right.
That's fantastic. Well, thank you so much for joining me. It's a pleasure to hear what's going on at Livongo, especially on the tech side. So thanks so much.
Absolutely.
Pleasure to speak with you. I'm Jessica DaMassa here at Connected Health Conference for WTF Health. Thanks so much for joining us.